Hypertension is very common, but it's often underdiagnosed. Since treatment of hypertension reduces the risk of death, heart attack, and stroke, proper diagnosis is very important. But it's also important to recognize that blood pressure in any individual is highly variable. This means blood pressure readings often differ just by the time of day, for example, morning versus evening. Also, the readings may vary by the season and by other factors, such as physical activity. Even if we measure blood pressure under the same conditions, a person's blood pressure may still vary. Because the diagnosis of hypertension usually results in lifetime treatment, it's critical to be sure of the diagnosis. How providers make the diagnosis of hypertension may slightly vary across countries, clinics, and providers. Here is one practical approach that is easy to implement. The process of hypertension diagnosis begins with an initial blood pressure measurement. It's important to measure blood pressure accurately. The person should be in the correct seated position and not talking. It's also important to choose the proper cuff size and use a validated device. If the systolic blood pressure, the upper number, is less than 140 millimeters of mercury, and the diastolic blood pressure, the lower number, is less than 90 millimeters of mercury at the initial measurement, then it's unlikely that the person has hypertension at this time. However, systolic blood pressure typically goes up as we age, and most adults will develop hypertension in their lifetime. For this reason, the person should consider returning and having his or her blood pressure measured again in a year, or at least in a few years. On the other hand, if the systolic blood pressure is greater than or equal to 140 millimeters of mercury, or the diastolic blood pressure is greater than or equal to 90 millimeters of mercury, measure the blood pressure again after 1 to 2 minutes. When someone's blood pressure is measured twice, often it's recommended to use the average of the readings. If this isn't practical, another option is to just use the second reading. If the average of the two readings, or the second reading, is greater than or equal to 140 millimeters of mercury for systolic blood pressure, or greater than or equal to 90 millimeters of mercury for diastolic blood pressure, it is likely that the person has hypertension. It is ideal to measure blood pressure again in a few months to confirm the diagnosis of hypertension. However, this may not be practical, and sometimes the diagnosis of hypertension may be made based on blood pressure measured on a single day. Once a diagnosis of hypertension is made, healthcare providers recommend lifestyle modifications and may prescribe blood pressure lowering medications. Lifestyle modifications include eating a healthy diet, reducing salt intake, and increasing physical activity. For most people with hypertension, the goal of treatment is to lower systolic blood pressure to below 140 millimeters of mercury and diastolic blood pressure to below 90 millimeters of mercury. Treating hypertension has been shown to reduce the risk of death, heart attack, and stroke. Let's summarize. First, it is important to diagnose hypertension properly because treatment of hypertension is lifelong. Second, an individual's blood pressure is highly variable. For this reason, it is important to repeat blood pressure measurements, especially if the initial blood pressure reading is high. Third, if systolic blood pressure is greater than or equal to 140 millimeters of mercury, or diastolic blood pressure is greater than or equal to 90 millimeters of mercury, the person has hypertension. Fourth, the goal of hypertension treatment is to lower systolic blood pressure below 140 and diastolic blood pressure below 90 to reduce the risk of death, heart attack, and stroke.